This is Group Blue, Digital Transformation Section 35. We'll be presenting a case study on virtual collaboration and knowledge sharing in the healthcare industry. Meet my group: Naomi, Jonathan, Yesenia, Melissa, Nestor, Fabjot, and myself, Florence. We'll be starting the presentation with an introduction, which will be presented by Yesenia. Yesenia, over to you.
Thank you, Florence. Next slide, please. As you can see in the slide, there are two pictures that show us how the communication has evolved. It's essential to know that the communication has been, is, and will continue to be very important in people's lives. And it has been more valued during the COVID pandemic, especially contactless communication. During the pandemic, we have felt the need to be more connected, share information or any experience. According to Fick et al. 2021, the COVID pandemic has changed the private lives of millions of people. In the same way, it has made it much harder for medical specialists to work together across global healthcare systems. So, to deal with the COVID pandemic or other crises and keep taking care of patients, several hospitals have made big changes such as technology and structure. In addition, Li and Ho 2018 mentioned that technology and networking are an important part of how people communicate each other today. So it would be smart to use technology and improve our current tools to start giving the best care of safety to patients in the future. Considering the above, the necessity to improve communication in a hospital where we are presenting as a solution alternative to Microsoft Teams, which has various or several features designed to improve team collaboration, productivity, and communication. Now, the background is with Melissa.
Thank you. So, firstly, we analyzed the background of the industry and also the internal and external factors that are affecting nowadays the Ottawa Hospital. Talking about the industry, we know that the Canadian healthcare system, its purpose is to be universal, accessible, comprehensible, and provide a good quality patient care. Also, the Canadian healthcare system, it consists in providing a universal coverage, health coverage with public and private coverage plans. The Canadian health system, it's one of the significant characteristics is that nowadays is not also providing care in all areas, but it's trying to be centralized in certain products and diversified in services so they can provide a premium experience to the customer. For example, some hospitals are centralized in pediatric care, others in geriatric care, in research facilities, or even they are educating young adults so they can also learn to contribute to society. The other significance of the Canadian healthcare system is, as my teammate said, the COVID-19 pandemic. COVID-19 pandemic generated new challenges and needs for the industry, which created a need for digital transformation, basically because systems were overloaded. There was amount of too many information and patients, and also they identified a need of more staff due to a skill shortage in the industry. And it was created a social disengagement between employees, teams and directors, patients and their families, that creating some more issues and challenges in the industry. In respect to the internal structure of the Ottawa Hospital, we emphasize that the hospital, its mission is to care for patients, educate, and research. It is thus always to contribute to society by educating young adults for patient care and to always be a part of the community and innovate. Since this is their focus, all their management plans need to be focused into the mission, into innovation. And they do that by having a board of governors that is a diverse pool of the community. This diverse pool of the community is chosen from the Ottawa and Ontario population that they provide the healthcare system. And this population will have help to develop open-minded and innovative solutions. In respect to the external factors of the environment that are affecting the Ottawa Hospital, the more important are that socially the population is in need for a constant and immediate communication of information. So we are currently requiring constant updates, and we want to have the information right now at this moment and be always communicating to others and knowing new things, new skills. The population is also aging, and it's a diverse population. This corresponds with the shortage of skilled labor that I was explaining before, and to be able to overcome these challenges, the government has also implemented in their vision to 2025 a purpose to retain capital, skills, and talent, and always technologies, new technologies involved, because the new technological environment is generating a need for specialized technologies and systems. This is due to some of the impact that is generated in the 5.0 industry, and this affects the environment of the Ottawa Hospital and all the needs and changes that they need to proceed to be able to be a step of the competition and always provide their mission to the patient's care. So the next part of our study, it's going to be presented by Nestor, that is case evaluation.
Thank you, Melissa. Now we are going to present the case evaluation. And the most prominent and relevant points regarding the case are related to the inconvenience that the system fault generate in the administrative and operational management of the hospital as a result of the failure to function of the more than 30 systems that the hospital has. Now we present the main inconvenience registered by the incident in the hospital systems. First, difficulties in communicating between hospital staff, mainly between frontline and staff. Communication problems due to the system collapse originate because the hospital email system didn't work, which is why communication between the areas was restricted and therefore didn't flow. Also, another communication system that stopped working was PACS, which is a medical imaging technology that's primarily utilized in healthcare organizations to digitally transmit and securely store clinically pertinent electronic image and reports. The second is lack of access to patients' medical records. One of the biggest disadvantages of not having the hospital system working was that hospital staff could not access the patient history records, whether they were patients from the same hospital or from another hospital, which originated that frontline doctors felt overwhelmed and confused at times because they didn't have the clinical history of the patient they were treating. And finally, use of manual process for patient registration and medical samples. Another of the process that has the biggest impact product of the system collapse was the recording of patient and medical samples. Not being able to record in the system the patient's entry to the hospital, the administrative staff found an alternative solution, replacing the automated process, which wasn't working product of the system fault, by the manual process. This manual process caused, for example, lab samples to be hand-labeled or the number of patients derived to the laboratory area not taken into account, which collapsed due to the large number of ancient patients. As a conclusion of this point referred to the assessment of the case, we can comment that not only the more than 30 system of the hospital ceased to function, but also that the alternative solution that were implemented in emergency didn't work, which indicates that the hospital didn't consider or prepare a contingency plan. Now, my teammate Naomi is going to present the proposed solution of the case.
Thank you so much, Nestor. So with all of the problems or issues that the Ottawa Hospital has encountered, we have proposed a solution of using the app, which is Microsoft Teams. So Microsoft Teams, we suggest that not just the Ottawa Hospital should use this, but the healthcare sector, because it not only makes existing operations simpler, but also produces a flexible operational canvas that can be changed and shared in the real-time events. Here are some of the insights that we have, or the advantages that we have gathered with the use of the Microsoft Teams platform. So one advantage is protected messaging. Teams improve the capability of secure communication by encrypted exchange of messages from outside of the organization, delegating and directing messages, repeated delivery of urgent messages, and virtual conversation with no privacy risk. The second one would be data gathering. On-site data collection may simply be connected with Microsoft Teams. While the EHR software is too large for mobile devices, the Teams platform offers a simpler method of entering data in your devices. Another one will be work and team collaboration. So the software platform provides a predetermined template of setting, channels, and pre-installed programs. By doing this, a ward pod department or several regions within a medical institution can quickly begin improving communication and teamwork. Having meetings and interaction occur on various devices makes deployment easier. The last one would be administrative work. Healthcare professionals and team members can collaborate on tasks, schedules, documents, and other things. Users can update each other with as much information as they can, as required by adding notes, locations, and durations using Teams schedule management tool or Microsoft Suite. So for the next part of our report, my colleague Prabjot will be discussing about it.
Thank you, Naomi. Right now, I'm going to talk about the SWOT analysis of this case study. If I talk about the strengths, the first one is Microsoft Teams is a powerful platform which enables Ottawa Hospital staff to collaborate and share knowledge virtually. And this platform has powerful features like video conferencing, chat, file sharing, task management, which enable or help to facilitate effective collaboration. And this platform is user-friendly and intuitive, which allows users to quickly learn how to use it. Lastly, it is highly secure and provides the necessary privacy and security to protect patient information. On the contrary side, there are some weaknesses, like the cost of using Microsoft Teams can be prohibitive for some. And the platform can be difficult to use for those who are not tech savvy. The platform may not be compatible with all devices, making it difficult for some users to access the platform. Even the platform may not be able to keep up with the pace of change in the hospital environment. There are some opportunities, like Microsoft Teams can be used by the Ottawa Hospital to create a secure and virtual environment for its employees to collaborate, share knowledge, and work together. It can be used to help streamline communication and reduce paper waste, can also be used to facilitate remote training and onboarding for new employees. Even it can be used to create a secure platform for sharing confidential data. Also, there are some threats like Microsoft Teams can be vulnerable to cyber attacks if users don't follow security protocols. And it can be difficult to manage and monitor user activity as the usage grows. Moreover, Microsoft Teams is a cloud-based platform and can be vulnerable to outages as it requires an Office 365 subscription, which can be costly for large organizations. Now, overall, this is the SWOT analysis for this case study, and now I invite my team member, Jonathan, who will elaborate the recommendations of this case study. Thank you.
Thank you, Parjot. I'm going to talking about recommendations for the hospital Ottawa. Okay, the first recommendation is going to be cooperation and knowledge sharing in the hospital. The hospital should establish clear guidelines in the teams so they can be used and shared to everybody. Another one is be ensure all of the team members adhere these guidelines about the access confident in patching data. Another one is going to be promote team option on the program. This one is going to be encouraged through the human resource area and communication campaigns. Another one is going to be the hospital should develop internal communication plans and virtual session trainings, virtual tutorials, and internal FAQ to answer common questions. The hospital should use like a Teams for all the virtual meetings. The first one is going to be department meetings, Teams handles, and one-on-one meetings. It's going to be in Teams. Another one is should provide guidelines for conducting effective virtual meetings to ensure that all the members know what's happened in the application. The last one is going to be establish communities of practice inside the Microsoft team. The first one is going to be create a community of practice that's going to be effectively facilitating knowledge sharing between the compares and partners. Also, they can be like a stability governance policy, a best practice inside. How's going to be inside the application? It's good, it's not good. What's happening inside for everybody respectful. Establish clear guidelines on a team's use, like access and confident information, education, training, and many steps that have going to be inside the app. Opens to the questions, to the give feedbacks to everybody, because it's going to be nice if everybody knows what happened after they use the application. And the last one is setting up a government's community responsibility for monitoring usage and insurance complaints. That's all recommendations. The next one is going to be my partner, Florence.
Thank you. So much has been said about the case study, and overall, the dynamics of virtual collaboration and knowledge sharing in the healthcare system in Ottawa were examined, and conclusions were drawn. Some of the points discussed are importance of working together, as well as the challenges, best practices for sharing information to stay connected and help bridge communication barriers, then the method used. SWOT analysis were examined on the Microsoft Teams based on the weaknesses, strengths, opportunities, and threats, and the recommendations. The recommendations emphasize on collaboration and knowledge sharing as critical components of effective communication and teamwork in the Ottawa Hospital to keep it running, even after pandemic. At this point in time, we'll be running off with our presentation, and thank you for your time.